Now, continuing on with our unfortunate Mrs. Garcia, we have to set up her treatment plan, um, and we have to get all of this stuff taken care of right here. So, where that starts is, if you remember correctly, she was a grade 3 whiplash. So that's 56 weeks, 76 visits up to. We don't normally go that long. It's hard to keep everybody's attention, but you could legitimately. So we want to change this treatment plan to multi-phase. Then we go down to edit. We're going to go to phase 1. So the first recommendations, the Quebec Task Force, is 5 times a day for 2 weeks. The next is 3 times a week for less than 10 weeks. So I usually just put 9, knowing that we may not go that far, but that's okay. You would rather plan for the worst. So 2 times a week for less than 9 weeks. Or actually at 9 weeks, okay. 1 time a week for 9 weeks, which is technically less than 10. Okay, and then you can do once a month for however many months. At this point, I usually just put once a month, or for 1 month. If they can go a month out without having a bunch of issues, then usually we're all happy. So what we'll do is we'll close that out. And if you noticed over here, as these complete, you need to be recording that they were completed. So, okay, we're going to say August 12th today was the beginning of this treatment plan. I'm not sure I got that right. Let me look at this. Yes. That is 5 times a week for 2 weeks. Yeah, okay. Now, that makes more sense. So, we're going to add these up. So this is 27 weeks, 31, 33 weeks. So starting at 8:12, let's count them down to 33. This is going to take a while. I hope you don't mind. 3, 4. So I believe that's about 33 weeks. So we're looking at August to March, and that's a long time. Now, normally, because I don't have the time to do all the alerts, we have added alerts in here that make sense for us. And so when I'm done with this, I'll go over to here and configure, and I will add, come down here, patient needs alerts. That means next time that patient comes in, my staff knows that they need to put in all of their alerts so that we're completely on target with their treatment and their case management. So if I were to do it by myself, or to show you what the staff has to do that, then let's go over here and make sure that we've got this area clear so that you can tell what we're doing. So we add, and okay, so we need to make sure that duties under duress and loss of enjoyment is done roughly every 4 weeks. If it's a very acute stage, you may need to go more than that. We want the front. No. Sorry, we want the provider, which in my office will be the back office girl. We want. You could do it like this, but we like to go 1, 2, 3, 4. Okay. So we know that every 4 weeks, add another one. Doesn't load. That needs to be the provider. And And I don't ever do this, so okay. So that's the September 9th was the date of the last one. So we'll go 1, 2, 3, 4. October 7th. One, 2, 3, 4. November 4th. And on until you get all the way through treatment. That way you know that you're doing dud and low every 4 weeks. All the way through March 31st. And we do the same thing. Well, okay, before I get there, we want to make sure that there's an alert in here that exercises are given. I will leave this on all future appointments so that I make sure that my staff does not forget to give those exercises out to those patients. We show our patients the machine versus man that I alluded to in the assessment tutorial. So again, I will leave that on all future appointments until it is taken care of. It will continue to chirp at them until I know that they've done it. Let's see, they need re-exams every 4 weeks. So again, 1, 2, 3, 4, and on, all the way out through March, so that every 4 weeks they've got a re-exam. Same thing goes with OATS, or outcome assessment, need to be done every 4 weeks. And then we do the phases. So phase 1 is complete in 2 weeks. So 1, 2. Then phase 2, you'll see over here, we'll go 9 weeks beyond that. So let's go 9 weeks beyond that. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, phase 2 will be complete on that date, and on. So that way you've got alerts that are completely keeping you on track, on target. The thing is just to take the time in the initial week or the initial day or two of seeing that patient to get those set up so that you've got them all, it's all automatic, and you never even have to think about it again. That is the number one best way to keep yourself on track. Excuse me. Okay, and before I let you go on this one, we're going to, I'm going to show you what we do over here. I have changed the names of these so that they fit my purposes a little bit better. We've got the insurance up here, so we know what's going on there. But I changed this to chief complaints and notables. So if there's issues sleeping, that would go over here. In fact, let's do that. Okay, so if you remember from our exam, she had neck pain on both sides. She was having headaches, left shoulder pain, low back pain bilaterally, left knee, but that's not bothering her anymore. And she's having trouble sleeping. So when I go in to see a patient, I can look at this roughly, and I can remember, especially if you're seeing the patient as much as we're seeing this one, I can remember this and remember what's going on fairly quickly just from this brief overview. And just to be sure I have a fairly complete picture of what's going on, I've got all of the positives that the patient was showing on the exam. Also, she had a concussion. So, anyways, this is just a way to keep yourself on your toes and knowing what's going on. Also, I'll use alerts if there's maybe a rib adjustment that can get easily forgotten. That'll pop up and tell me rib alert or whatever else, you know. So, okay, I think that takes care of this portion of our personal injury. If you have any questions or any suggestions that we can use to make this better, please feel free to email me at amarillo, PACC, @gmail.com.